Welcome to State of Wellbeing, a podcast from South Dakota State University. The State of Wellbeing is a holistic well-being podcast with the goal of supporting the campus community as we strive to be a growing, high-performing, and healthy university.
Well, welcome to the State of Wellbeing podcast. Today's episode is regarding dietary supplements and their role in well-being. I'm Shari Landmark, Chief Wellness Officer, and today we have a special guest, and I'll let him introduce himself.
Yeah, hi everyone. My name is Joe Berendse. I'm an associate professor with the College of Pharmacy and Allied Health Professions. And yeah, I have a special interest in dietary supplements. We teach it within our curriculum for our pharmacy students, and so I help do a lot of that teaching. So I have learned a lot about dietary supplements and their regulation and how it can be safely and effectively kind of incorporated into people's lifestyles.
Great. Well, appreciate you being here today with us. We, being located within the Miller Wellness Center here at SDSU, we do see a lot of students taking supplements and as well as faculty and staff. So I appreciate that today. So let's kind of start off about just really understanding the basics of supplements. So what exactly qualifies as a dietary supplement, and how do they differ from maybe over-the-counter medicines?
Sure. Yeah, so the FDA defines dietary supplements really as any vitamin, like vitamin C or D, any mineral like iron or calcium, or any herb, kind of like St. John's wort, that is meant to primarily supplement the diet. So not to treat or, prevent or cure a disease, but more to kind of just support supplementation of the diet. So as a result of their intended use, they're not classified as like over-the-counter medications, and they're more so regulated more closely to what food products see. So those are the two big differences, I would say, would be their intended use and kind of the regulation as a result.
I think that is a really important point of it, to supplement what you aren't getting, and I think
Exactly.
That's a piece that people don't know what they're already what they're getting and what they need. So what do you see are some of the most common supplements that are maybe taken by college students or taken by people that are maybe misused or not needed?
Yeah. Well, kind of according to most published surveys in the past 10 years, the most widely used dietary supplements among college-aged individuals would be multivitamins, which is true for all age groups. So that's the most widely used dietary supplement, is just kind of a once daily multivitamin. Additionally, folks between the ages of 20 and 40 tend to use dietary supplements that are intended to promote like energy and immunity. So things like caffeine supplements are common in this age group. Echinacea, a dietary supplement used for immunity, also very popular. And melatonin for kind of sleep. Those are some kind of more popular dietary supplements in this age group. I think it's, especially for our college-aged students at SDSU, there's a lot of demands. There's a lot of stressors for them in their daily life. And so it makes sense why they're kind of reaching to these products to boost their performance day to day.
That is so true. We do have a lot of stress and trying to, whether managing classwork and then if they have a job and trying to, cram in, and then all the social part that comes with college
Yes.
as well is always not very easy. So some of the common, I guess maybe we talked about this, the misconceptions and confusion between the supplements versus medications. Could you talk to me a little bit about that?
It goes a little bit back to regulation. I think it's very easy for a person to assume that if a product's on a store shelf, then it must be safe. But unlike medications, both prescription and over-the-counter medications, the FDA usually does not require a pre-review of the safety or the effectiveness of most dietary supplement products that hit the market. So the FDA does kind of have a post-marketing role, meaning that if something is found to be unsafe, the FDA will work with the manufacturer to get it pulled from shelves. But potentially that means products are sticking on the shelf for months or potentially even years before the FDA can withdraw them. Um, so yeah, because they're more closely regulated as food products too, sometimes the high purity standards that apply to prescription and non-prescription drugs don't apply to dietary supplements, meaning sometimes there's too little or too much of what they say is in the bottle, leading to some kind of inconsistencies.
So, those supplements that have been shown to be safe and effective or not, if we're trying to say, hey, try more of a natural route, what are some of your maybe suggestions to help with stress versus maybe a supplement or help with cognitive performance instead of a supplement?
Yeah, well, I would say first of all, I'd always encourage students to kind of check in with their providers, their pharmacists, the Student Wellness Center, just some of those resources that are out there prior to considering a dietary supplement. And as always, kind of like you said, Shari, I would promote the basics. So adequate sleep, good nutrition, and good social support and kind of mental wellness. But a couple of things that dietary supplements that have been kind of more, I guess, shown safe and effective for the college-age population would be echinacea, which I did mention earlier, has been shown to be likely safe and possibly effective when used kind of short-term. So I think of this as like, something potentially to think about during finals week that, students can safely think about for short-term use just to make sure they don't come down with the cold while they're trying to study for these high stress, exams. And then maybe not related to stress, but another one that I would kind of point out that's salient to the college population is cranberry has been shown for like recurrent urinary tract infection prevention. And even the American Urologic Association says that it can be considered as a likely safe and possibly effective product. So if someone struggles with that, of course, talk to your provider, but also consider cranberry supplementation.
Okay. Yeah. And it's always something, right?
Yep.
I mean, there's things out there, right, that can help. This may be, is it myth or fact? You talk about melatonin. Are pistachios a good source of melatonin to maybe take instead of an actual supplement?
That's a good question. Yeah, melatonin comes from tryptophan. So we always think of tryptophan when we talk about Thanksgiving, which is right around the corner. So that's kind of funny you bring it up. But that gets converted in the body into melatonin, which again, kind of is just a natural substance our brain releases to help us know that it's time to fall asleep. I have to double check the contents of pistachios, but I do believe they're pretty high in tryptophan. So that could be a potentially good source. As well as the omega-3s for, yeah.
I'm just kidding. So with that, there's seasonal affect disorder. If you could maybe explain what that is and maybe what the deficiencies are with that and how we can combat that here this winter.
Yeah, I think that seasonal affective disorder is certainly prevalent in our part of the country, in our part of the world. It's kind of this pattern wherein a person notices lower energy, lower mood, and symptoms that are consistent with depression, typically that fall in line with the winter months. So when the daylight is shorter, people notice these kind of higher rates of, depressive and kind of anxious feelings. So one of the really cool things, and this is kind of aligned with natural supplements that is used to treat seasonal affective disorder, is actually prescribed sun or light boxes. And so I would say if someone combats or is combating seasonal affective disorder, talk to your provider about potentially looking into these light boxes if you're not interested in some of the alternatives of being treated that way.
Great, thank you. Because we just can't maybe afford to go down to Florida for a week or so.
Yeah,
right?
It would be really nice to get a prescription for that, but I don't know if insurance will cover that most of the time.
We'll have to work on that.
Yeah.
So when students are looking for a supplement, whether it is for seasonal affect disorder or whatever the case may be, what are some things that they should be cautious about, especially those that are marketed for like the weight loss, the energy, muscle building? We're going to be getting through the holidays, and then it's New Year's resolutions for people. And, as much as I'm not a big fan of that, we know it's going to happen. So talk to me a little bit about some things to be cautious for with those areas.
Yeah, I would just very much kind of like you're alluding to, Shari, urge students to be wary of products intended to promote weight loss or muscle building. I think manufacturers know that this is such a personal, thing to a lot of people, weight loss, body recomposition, body image. And so the way they market it can be a little bit misleading in cases. Especially for our college students that compete athletically on the collegiate level. A lot of these products are at high risk actually of containing undisclosed products or undisclosed substances that are actually banned by the NCAA for athletic competition. And that could put their kind of collegiate athletic career in jeopardy if they were to, take it in good faith, hoping to do better, hoping to perform better. But unfortunately, the manufacturer just didn't do an adequate job of screening it. We'll maybe touch on this a little bit later, but ways that students can kind of look for good products would be to look for, there's what are called voluntary verification programs. These are programs that review products periodically. They'll just pull them off the shelf and do some rigorous chemical testing to make sure that what they say is within the product actually is within the product. And then those that have that seal, which could be like USP or US Pharmacopoeia, consumerlab.com, or NSF, National Sanitation Foundation. Those are 3 different programs you can look for on the labels of dietary supplements to say, this has been tested and it contains what it says it contains.
Because I think it is. They market those feelings, right, that people
Yes.
have, and they just dig it and they know how to do it. And being able to be cautious of some of those marketing claims, and so we're not getting misled into something that maybe is harmful to us. I think it's really important to know where to look for those that information, and to know what those supplements are actually doing to our bodies.
Yeah.
Great. Well, yeah, this is just mind-blowing to me, I think, and it could be multiple episodes, I think, with the supplements and what we could talk about today. So with the supplement labels, I think sometimes it's hard even just to read, if I have a cold, of, how many do I need to take and how often. How would you, I guess, go about explaining how to read the supplement labels?
Yeah, so like all food products, dietary supplements will have what's like a supplement facts panel that largely mirrors a nutrition facts panel that we're used to reading on most food products. So it'll tell you how much it contains of, various vitamins, various minerals, and how much of the percent daily value that would constitute if you were to take it as directed. And so what I would advise is just, looking at that label and really just being wary and asking questions. If you see these astronomical numbers that are like, thousands of percent of the percent daily value of these different vitamins, not all vitamins and minerals are harmless when taken at kind of high doses. So if you see a supplement that has these really high values, question it with your provider, question it with a pharmacist, question it with somebody before you kind of decide to introduce that to the body.
Great. Yeah, I think I keep hearing that message of talk to your provider. And I really think, a lot of times we think we only should go see our provider when we're ill, right?
Yeah.
And not when we're healthy. And it's important for all of us at any age to go in and get our annual checkup and talk truthfully to our provider about our health and what we're doing, so they can best help us choose the right product if we need, or get us to our pharmacist to help us select the right product.
Exactly. And I think there's sometimes a conception, people think that either their providers or their pharmacists are not maybe interested in what they're taking, as far as dietary supplements, or maybe aren't knowledgeable. But I would really just kind of encourage folks to talk to your providers about this. They may surprise you with how much information they can give you about various supplements and how much guidance they can provide for folks that are interested in dietary supplementation.
Great. So kind of moving on just to like some practical guidance, and we've kind of talked about that, but are there specific times or conditions when the supplements are helpful for students? And we talked a little bit, I guess, about the flu season and high stress or poor diet, but can you maybe expand on that a little bit?
Sure. Yeah. I know with college age years, it's really tough to have a consistent diet that is high in, nutritional value at all times. I understand that. So first thing I would say is a once daily multivitamin is great. Maybe not necessary for all folks, but probably won't put you in harm's way. And it'll meet all of your kind of vitamin and mineral needs without putting you in a state of excess. So if you're worried about just a poor diet, a once daily multivitamin can be a great incorporation. Additionally, for our students that maybe have certain patterns of eating that follow like a vegan or a vegetarian food intake pattern, looking at supplementation of B vitamins is definitely something to look into, especially vitamin B12, which they can become deficient on if they don't supplement it in some way. And then people would know about this already. They'd already have talked to their providers, but if you have any sort of condition that prevents you from absorbing nutrients, like certain intestinal diseases or maybe a history of stomach surgery, things like that, you definitely ought to be on kind of a once daily multivitamin to help prevent some of those deficiencies. And then kind of like we talked about, Shari, I think high stress situations in the cold season, considering just, making sure you're getting enough sleep and enough hydration, and maybe that echinacea could be incorporated as a strategy too.
Yeah, sleep is tough for college and
Me
adults,
too.
right? To get that 7 to 8 hours of sleep a night, and being consistent with that sleep, I think is hard. And the phones and all of that, it can create a lot of stress. And I truly believe sleep is just so, so important to our health. So
Yeah.
important to our health. What would be your tips or hints about with students having kind of integrating supplements safely into their daily routine without overdoing it or creating any type of dependency on that? And I would even count caffeine into that, wouldn't you say?
Yeah. Yeah, I would be cautious with, too much or too little caffeine, or even just abrupt changes in your caffeine intake pattern can create some, headaches and withdrawal-like symptoms. So I would say, first of all, just following the labeled dosing on various dietary supplements. More is not always better. In fact, more is oftentimes not great at all. So just following what is recommended by the manufacturer. Most dietary supplements have been kind of studied for short-term use. So I would say make that your goal, is try to use them for just a shorter duration. And if you notice that you're having to use them or relying on them for more than a month or two, it might be time to talk with somebody about that. And then, just making sure you incorporate your provider into the plan. So, if you're noticing that the dietary supplement is not working for what you thought or what you were using it for, your provider can definitely advise you on other routes, not just like a medication or a prescription, but also getting you into therapy or looking at other kind of approaches to manage various conditions.
Thank you. So what role you did talk a little bit about this, but the role the healthcare provider or our campus wellness centers can play a part in guiding students on this supplement use.
Yeah, I would just say we are your partners in kind of making sure we're using it safely and making sure that, you're not just throwing away dollars on products that are known to not be effective. We can kind of help you locate that information. There are so many new dietary supplement products that hit the market every year. So it's impossible for most people to kind of keep up to date. But I think the folks in the Student Wellness Center, I think your healthcare providers, they would know where to look for information to help guide you on that journey and yeah, make sure it's safe for you.
Yeah, and that's what's great for our students. We have our student health clinic right on campus, and they can make an appointment, see a provider, and talk with them about their health before it's too late and they're sick, they're down, and they really do need to come in and see us. So that's great. So any final advice from you that you could give us today on just supplements and how we can safely take them?
Yeah, I think my last, I guess, pearl of wisdom is just when you're selecting a supplement, if you decide to go with that route, opt for kind of those larger, more reputable brands where possible. So you might have heard of like commercials for the Nature Made brand of products or Nature's Bounty. Also, the brands that the large retailers kind of, put forth. So like the Members Mark from Walmart and Sam's Club or Up and Up from Target. Those would be the ones that are going to be a very low likelihood of having, either contaminants or not having what they say on the label is actually in the bottle. So pick those as your first stop. And if you're seeing a lot of claims about like this is used for a wide variety of conditions and it uses personal testimonials in the place of any sort of, evidence, I would maybe steer away from those products.
Really good advice.
Yeah.
I'm sure I've seen a few of those commercials out there for sure, right?
Absolutely. Mostly at like midnight or 1 a.m.
Oh, then no, I haven't because I'm sleeping.
Yeah. Oh, yeah. Good call.
No. I ate my pistachios. No, I'm just kidding. Well, I just want to thank you so much for taking time today to talk a little bit about this and to give our listeners an opportunity to find some resources to check into supplements if they are taking some or if they're thinking about taking different supplements, whether that's online or talking to their provider or pharmacist, because I really think it is important to do your research and make sure that you're doing the right thing.
Absolutely.
Thank you for joining us today, and I hope you can join us again soon.
Yeah, absolutely. Thank you, Shari. Appreciate the time.
Thank you.
Thank you for listening to this episode of State of Wellbeing, a podcast from South Dakota State University. This podcast is brought to you by the Mental Wellbeing Team and SD State Health.